My name is Felicia. I'm 28 years old. The biggest symptom is the jaw pain and the jaw clicking. It's right here in this left side. It'll click very loudly sometimes where you can almost hear it across the room. And then it'll lock occasionally where I won't be able to open it. It started about 6 years ago. The level of pain, the highest level of pain when it gets really stuck and stiff will be about an 8 or 9. On a normal day, it's a 4 or a 5. It does kind of bother me a little bit. It's mostly on the left side. When the left side is really, really bad, the right side will get tired and sore from overworking, I think, from the left side. The level of pain at resting, about a 3 or a 4. Stress tends to make it worse, or talking too much, chewing foods that are kind of sticky, or chips, crunchy foods, and it hurts right here. It'll get up to a 7 or 8. Yeah, I've been told that I talk sideways, that my mouth opens to the right when I talk. It's mostly just a noise. Sometimes it'll hurt. Probably less than 50% of the time though, when it does click, it'll hurt. Also on the left side in the same spot right here. But mostly it's just sound. My second is my back pain. I get lower back pain. It's probably about a 4 or a 5. Sometimes I'll get shooting back pain in my sides, and that could be a 7 and 8, and it'll come out of nowhere. It happens every few weeks. Not very long, maybe a couple minutes at the most. How long ago? I'd probably say about almost a year ago the back pain started. And when I'm not doing anything, it can be a 2 or a 3. My third one is my headaches. I get really bad headaches on the left side behind the ear. They've been a lot more frequent lately. The worst it can get is an 8 or a 9. It started 6 months ago is when they started more frequently. The usual level is a 4 or a 5. I'll just take some pain medicine for it. And then occasionally I do get stuff on the right, but it's a lot less frequent. And the pain for that is about a 3 or a 4. I've mostly just tried pain medicine, tried to just deal with it. Most people were like, it's just normal stuff. So like, headaches, they're like, everybody gets headaches, just take some pain medicine, it'll go away. Or back pain, they'll be like, do some stretches, help your back out a little bit. Yeah, I am young and I feel maybe a little bit older than I should feel at my age. I get fatigued and tired probably more frequently than I should.
And it's jumping right out of bed. You mentioned about fatigue, but how last?
Probably about a 3. Sometimes I stay in bed a lot longer than I should. When I don't have to go anywhere, I'll sleep up to 12 hours. Not a lot of energy, a 3 or a 4. The maximum energy, probably about a 7 or 8. I run out of gas before the end of the day. I get back down to a 5 or a 6. Start getting fatigued again. Probably after about 4 or 5 hours. Probably almost in the top 3. Jaw first, and then probably fatigue, and then headaches.
And then the back pain?
Yeah.
With your back feet together, arms all the way up. Bite down tight. I'm going to try to push down. Don't let me. Do your best. Bite down tight. Bite down tight. Bite down tight. Okay, do your best. A little higher. Bite down tight. Do your best. Bite down tight. Okay, that's your baseline. Now lean against the wall. Have your feet out a little bit. Same width as before, but you're getting support from the wall. Arms all the way up. A little higher. A little higher. Bite down tight. Use the same 2 fingers. Bite down tight. Bite down tight. One more time. No difference at all. All right. Now, let's use this myobite. Come on back here. This is your diagnosed jaw position, neck position. Open again. Just a second. Just a second. Now bring your teeth into the indentation. Arms all the way up. A little bit higher. Bite down tight. I'm going to try to push down on your arm. Don't let me. Do your best. A little bit higher. 1 finger. No deal. No deal. Arms up a little higher. I'm going to use 3 fingers. Bite down tight. No. 4. That's my shoulder popping. A little bit higher. Bite down tight. One more time. Do your best. A little bit higher. One more time. I can't bring you down. I'm going to use my weight. Bite down tight. And bend my knee, use my weight, 180 pounds. Bite down tight. Okay, stay right where you are. Don't change anything. I'm going to take this one out. Put your natural teeth together like you're living now. Bite down tight. Arms all the way out. I'm going to use the same amount as a second ago. In fact, I don't think I need to use my weight at all. Do your best. At least 20. So your body's doing all day long is fighting this. You have this misalignment.
My top symptoms were jaw pain, jaw clicking. It feels better, almost 50% better. The jaw clicking has almost completely stopped. And the jaw pain and the jaw stiffness is almost gone. I used to get told that I talked sideways, and my boyfriend told me that I'm already talking straighter. He noticed that. The second thing was fatigue. I would not sleep very well. I would be restless at night. I'd wake up with not a lot of energy, and now I feel like I sleep through the night more and I wake up with more energy, and it lasts throughout the day. About 40% on the energy. My headaches have been a lot better. I've only had one minor headache since getting it, and it was very minor.
Percentage change?
Percentage change, 50%.
Okay.
The back pain is a lot better, 70% I would say. I haven't really experienced any back pain or shooting or stabbing back pain in the last 4 or 5 days. My balance is really good. I used to notice balance issues. I would move around a lot, so that is probably, 60% better. And then my gut is 20 or 30% better. I don't feel as bloated after I eat, and it just feels like things are working more smoothly. I wasn't expecting to get better this fast. I noticed quite a rapid improvement on my quality of life, even in the past 4 or 5 days. So. Overall, I'm doing really well. Probably about an 80% improvement overall. My jaw pain has been great. It's almost completely gone. That's probably an 80% improvement as well. The other symptoms I had were fatigue. That's a 90% improvement. I sleep so much better and I wake up more refreshed. Yeah, it lasts a lot longer throughout the day. I don't get tired as quickly. My other symptom was headaches. That one's 90% better. I haven't had a headache since the beginning of treatment.
That's not what it used to be.
No, not what it used to be at all. And when I do get them, they're very, 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 very mild. And the last symptoms was back pain. My back pain is 100% better. I haven't had any back pain, haven't had any shooting pain since we started the treatments. Yeah, I noticed my anxiety was a lot better. I haven't been getting stressed out as much. 80% better.
Okay.
And my dizziness is 90% better. I used to get a little lightheaded and dizzy, and I don't get that anymore. Initially, I was expecting to maybe help with the jaw clicking and the jaw pain. I didn't think there were so many other symptoms like the fatigue and the headaches and the back pain that were all related to it. So that kind of blew my expectations, knowing that all those things could, be better and improved if my jaw was improved. I would do it the same. I would do it again. I would pay for it and everything because it was worth it.